Hello, my name is Dr. Kristine Erlandson, and I am a researcher working on the RECOVER initiative.
Hello, my name is Rebecca Lutz, and I am a patient representative working with the RECOVER initiative. What is RECOVER? RECOVER is an NIH-funded research study aimed at understanding the long-term effects of COVID-19. In this video, we will talk about whether there are any routine blood tests that could help the doctors figure out if someone had COVID-19 or has long COVID, also called post-acute sequelae of SARS-CoV-2 or PASC, after they had the virus.
How did the study work? Well, over 10,000 people took part in this study. Some had COVID-19 before and some didn't. We reviewed a variety of lab tests, like blood and urine tests, to see if there were differences between people who did or did not have COVID and those who did or did not have long COVID. Importantly, the tests that we looked at are those commonly available in most clinical labs and those that might be requested by a doctor, things like cholesterol, kidney and liver function, diabetes tests, blood counts, thyroid, and more. What did we learn after reviewing lab results? Well, people who had COVID, even if they didn't have long COVID, had some small differences in their lab results compared to people who had never had COVID-19. For example, they had lower platelet counts, which are important for blood clotting, and higher levels of blood sugar measured by a hemoglobin A1C. However, there was no difference in lab test results between people who had long COVID or PASC and those who didn't. This means that the lab tests couldn't help doctors figure out who had long COVID.
What does this research mean for patients and healthcare teams? In short, these findings tell us what could be risks for getting COVID-19, what could occur after having COVID-19, like diabetes, that routine lab tests can help ensure that other conditions aren't contributing to long COVID symptoms, and routine tests ordered by doctors do not help to diagnose long COVID.
Why is this research important? Well, the study shows us that doctors should not rule out a diagnosis of long COVID based on normal lab tests. A diagnosis of long COVID should be based more on a person's medical history, their physical exam, their symptoms and findings. Routine lab tests can help us rule out other causes. And most importantly, this research helps shed light on how hard it can be to diagnose long COVID in people who are sick with this illness. RECOVER and other researchers are continuing to study new blood tests to help diagnose long COVID and learn more about what causes the disease.
On behalf of all RECOVER researchers and representatives, we are excited to share these and future findings with you. If you would like to learn more about the research we did, please visit the publications page on recovercovid.org.